really, we invited you all onto this call in the hopes that we could talk you into working with us and taking action. And as Carolyn said, the first thing we want everybody to do is to encourage hospitals in every community to sign the pledge. And if they've already signed the pledge, to thank their hospitals for signing the pledge. I think for every state legislator, we sent a packet, and in that packet, we put the names of the hospitals and the hospital administrators in your districts and their phone numbers to make this as easy for you as possible. And our hope is that you will actually use that information to get in touch with your hospital administrators. Let them know that you know about this initiative, you know how important it is, and that you really want to support them and reinforce their work. Which takes me to the second point on here, which is creating visibility and more community awareness of this initiative. Just your getting involved, just your reaching out to the community, just you maybe going out to do an event with the local hospitals in your district could help raise community awareness of the importance of this initiative and the work that needs to be done. And we can help you do that if you're interested in doing it. We can help you also find constituents in your districts who have stories they can tell. There's nothing quite so powerful or interesting to the local media in your communities and those personal stories, and sort of combining a personal story with your presence and the hospitals can really help raise visibility and be good for us all around. And then finally, this is not just a one-time thing. This is not just about signing the pledge. The pledge is a pledge to achieve the goals that Carolyn laid out, to really reduce hospital errors and to really reduce readmissions, the things that are costing huge amounts of money and causing huge amounts of harm and pain and suffering to patients. So we would encourage you to go beyond just the initial contact with your hospitals and to get involved with them as they work to achieve these goals, and in particular to work with your constituents and the consumer groups in your community who we can help connect you with in addition to the providers. And as Carolyn just said, patients and families can be a huge part of the solutions. Many of the hospitals and providers that have done the most creative work will tell you that the really highest leverage impetus for change they got was from the patients and family members who came up with ideas that they hadn't thought of and were really an inspiration to the whole team. And if you think about it, it makes sense. Who sees it all? None other than the patient or the patient's family caregiver, in a way that no one part of the healthcare team ever sees. You know, the doc comes in, the nurse comes in, the aide comes in, but only the patient sees it all, and the patients are an incredible source of information and ideas for how we can do this better. And finally, I want to say that all of this is about improving care and saving money. We are extremely aware of the budget pressures that states are under, and we know that there's a lot of pressure right now to slash budgets, and Medicaid is one of the things that everybody's looking at. And in our mind, there's a sort of good way and a bad way to go about this. Yes, it's probably easiest to just slash budgets. And for sure, we know that's going to cause pain and harm. It means reducing services. It means cutting off beneficiaries. It means cutting payments to providers. Lots of hurt, lots of harm. And at the end of the day, you've done nothing to really solve the underlying problem. And while in the beginning it may affect mainly poor people, eventually it affects everybody because we're making the system harder and harder for anybody to afford. So the way we would like to see this done, the better way, we think, is through transforming the healthcare system, improving care in the kinds of ways that Dr. Leap and Dr. Clancy just talked about. As you could see, there are millions of dollars we can wring out of the system by just doing what it takes to provide safer and better care. And that is just one of many steps that we can use to lower costs and improve care at the same time. So with